Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Hip Anatomy. We'll talk about all about the hip. We want to know all the structures in the hip region. Start step by step. All the structure, including the bones, the articular cartilage, the vulvar, haversian fat pad, labrum, capsule, burses, ligaments, muscles, nerves, blood supply, lymphatic vessels, all of these areas. And we have to discover it from the surface by surface anatomy. And also we have to know layer by layer, like a surgical layer by layer hip anatomy. These are the hip region, and we'll discover all about all of this area regarding the hip joint and hip region. Hip joint or hip region, we have starting by the hip joint. Hip joint, like any joint, any bone meets together, any bones meet together, they are forming the joint. Here, the nominal bone, or sometimes you call it coxa and femur, they are meet together and forming the hip joint. Hip joint is the most strongest joint in our body. It is responsible for transferring all of the loads from our body downward to the ground, and doing the reverse, they receive all the loads, the ground reaction force for ground back again to our body. The bone formed, the joint formed before, like what I said, we will see the nominal bone. Well, sometimes we call it coxa, and this is the femur, this is the upper part. We see here, this is the anterior view, and here from a lateral view, and here from the posterior view. We'll talk the first surface. First surface is the acetabulum. We'll talk first about the nominate and how the acetabulum is formed. The innominate bone formed from three connecting bones, the ilium, the ischium, and pubis. These three bones are connected together. In the early age, or in the infantile stage, these bones are separated. And even in the X-ray, we can see it clearly until age about 20 years old. We can see these three bones separated, what we call triradiate cartilage or triradiate. This is, you see, here's acetabulum making a Y shape. This is the acetabulum cavity. The acetabulum cavity formed from the ilium here and ischium and the pubis. They meet together to form the acetabulum cavity. This is the acetabulum rim, this is the acetabular fossa, and this is the acetabulum notch. This cavity is interrupted by the acetabular notch. And you see this is the acetabular notch here in the obturator foramen. This connection is very important because the blood supply and nerve supply passing from this area. We'll talk it later about that. Here in the ilium, we can see some features here, important features. This is the iliac crest upper part. This is the anterior superior spine, anterior inferior spine, this posterior superior spine, where the sacroiliac joint is formed here. And here, for the pubis, we can see this is the pubis body and this pubic tubercle, and this is superior pubis ramus, inferior pubis ramus, and this is ischial body and ischial tuberosity and ischial ramus here. For this, we have to know that, don't forget, this is obturator foramen. It is very important, this foramen. Okay, we will talk about it later, and we know that we will know how the blood supply coming to the head of the femur from this area, especially in early age. Also, we have here the posterior column and the anterior column. If we see this one, we can consider that the acetabular part, the ischial part is the posterior column, and the ilium and the pubis is the anterior column. However, if we draw this line like that, we will talk about this line later. If we took the line here from this wing here from ilium to the inner surface here of ischial, this is the posterior column, and this is the anterior column if we are going to this area. The anterior column and posterior column, we'll know it or we'll discuss it in the fractures and some diseases, okay? Here we look to the nominate bone from inside. From inside, we can see here, this is the iliac fossa, and we can see here the floor. This is the most important for me, the floor of acetabulum. This is the floor of acetabulum from the behind, and you will find this is also a Y-shaped here. This is the floor of the acetabulum. It is interconnected from three parts, the ilium, ischium, and pubis. And see, we will see that before, after that, later on, we see that in this upper part is the most important part that transmits the body weight. We'll talk about it, and the role of the femur and ilium bone, especially to transfer these loads from the body downward and from the ground reaction force from the ground upward. Okay. Okay. Also, we said that this is the ilium or nominum bone is inverted Y-shaped. However, the acetabulum here, it is a Y-shaped. Okay. Then we are going to lastly, sorry, we are going to the femur, the upper part of the femur. Femur here is formed from the head of the femur, well-defined bone. It's about 2/3 of hemisphere. Very good. This is very important one, and we will see that the acetabulum should take the be congruent as much as it can with the head of the femur to make it so stable. So the acetabulum should be deepened to accept the head of the femur. We'll see it later. And this is the neck of the femur, and this is the greater trochanter and lesser trochanter. From behind, we will see this from posterior. We'll see the intertrochanteric crest. However, from the anterior part, we see the intertrochanteric line, and also this is the subtrochanteric notch. Don't forget, this is see here in the middle of the head of the femur is the fova. This fova is the connection or entrance or antithesis of the ligamentum teres. Ligamentum teres, this ligament carry the blood supply and nerve supply to the head of the femur, especially in the early age, and responsible for its maturation. The femur is formed from three parts. The epiphysis, this is the upper part, and the metaphysis, where is the epiphyseal plate, and diaphysis, which forms the bone of the shaft of the femur. That's all about the bones in the hip region. In the next lecture, we'll talk about the articular surface and how it's formed. Be tuned to the next lecture. Okay. Goodbye.